Call this meeting of the Board of Commissioners to session. Roll call, please.
Commissioner Lloyd? Commissioner Winfrey?
Here.
Commissioner Gessinger?
Here.
Commissioner Brown? Here. Commissioner Avery?
Here.
Commissioner Shoemaker?
Present.
Commissioner Kuzma?
Here.
Commissioner Wayhill?
Here.
And Commissioner Flewelling.
We have quorum. Invocation tonight will be delivered by Commissioner Gunziger. Gary, did I say it right?
Are you please? Lord, thank you for allowing us all to be here tonight, and give us the wisdom and the strength to make good decisions. And thank you for a great county that we live in. Amen.
Amen.
You stand for the Pledge of Allegiance, please.
Pledge allegiance.
I need a motion to approve the minutes for February
I'll move it.
26th.
Support.
I have a motion and a support. All in favor?
Aye.
Opposed? Motion passes. Public address. You're here for public address. Please come to the microphone, state your name and the county or township you live in or city. Do we have anyone for public address?
Anyone? Thank you very much. Ian Shetron, Flushing Township. Good evening, Commissioners. My name is Ian Shetron, and I'm here today to introduce myself and ask for your consideration for a position on the Bishop Airport Authority Board. I'm a lifelong resident of Genesee County, a finance professional for a local company, and a frequent business traveler through Bishop Airport. Most importantly, I understand firsthand the critical role our airport plays in driving economic growth and an opportunity for our region. In my role as Finance Operations Manager at Insight Management and Consulting Services based here in Flint, I oversee treasury operations, investment strategies, and a real estate portfolio for over 40 entities. I also work directly with the management of Insight's corporate jet, which is based at Bishop Airport, giving me direct experience with the airport's operations from a business and ownership perspective. Bishop Airport is one of Genesee County's most valuable economic assets, but its full potential can only be realized with strategic financial oversight and forward-thinking leadership. We must view the airport as a catalyst for attracting and retaining professionals, businesses, and investment. By ensuring it remains efficient, accessible, and competitive, we can help make Genesee County a destination of choice for businesses and professionals who value both affordability and global connectivity. If appointed, I will bring my financial expertise strategic planning experience, and passion for economic development to the board, working to ensure that Bishop Airport remains a strong driver of growth and opportunity for our community. Thank you for your time and consideration, and I look forward to the opportunity to serve. Thank you.
Good evening. My name is Monica Villarreal. I'm a Flint resident and an active clergy in our community, and today I represent Michigan United. We, along with several other coalitions, have been convening our local healthcare agencies, medical providers, social service agencies, advocacy orgs, faith community, and other community members to better understand what's at stake with the federal government, conversations around budget cuts, especially to critical programs such as Medicaid, SNAP, and TANF. We understand that this impacts Genesee County not only for the programs in which you as a body oversee in terms of budget, but it has far-reaching implications throughout the community, in our healthcare system, in agencies that are dependent upon federal funding. We have started the process to understand what these potential impacts, cuts, reductions might mean for Genesee County. I hope you received the packet that our team has put together. We highlighted some data that we think is important for decision making. The packet itself, so that you know, is put together by over 30 community members with over 50 invited to review this information. We've provided you what we think is most critical at this time for us to consider. And in talking with all these folks, we've learned that the federal cuts would have catastrophic and rippling effects for Genesee County. And what we'd like to do is invite you all into the broader conversation, not just the budget that you oversee, but the stakeholders in the community, to better plan how to handle significant disruption and dismantling of our county's healthcare system and the vital programs that it supports. We were here today to really start the conversation and welcome you all to the table as we continue this work. Thank you.
If it would please the board, ma'am, did you have more you'd like to add? If it would please the board's okay with it, I'd like to allow her to continue if that's okay. If you had anything else.
Thank you. I'll just highlight both for the board and for the public some of what's at risk. The key highlights. 28% of Genesee County residents rely on Medicaid, specifically for their affordable health care. That's over 100,000 residents of this county. These are your constituents. 56% of all births in Genesee County are covered by Medicaid, and that includes the prenatal care, the birth, and the postpartum. 93% of mental health services provided by Genesee Health System are Medicaid reimbursed services. And Mr. Russell has also indicated to us that most all of their programming relies on federal aid. We have, as you may know, 3 federally qualified health clinics in the county, which provide primary care to the low-income families in our community, and over 60% of their patient population is covered by Medicaid. These are just some examples of the outside the budget of your purview, but community impacts. And part of the goal is to work with you all in some way to help plan, we have to mitigate these, but also really just advocate. So talk to anybody you know that we can advocate for Genesee County, your constituents, your residents, that these cuts don't happen at the federal level. I think that's the biggest thing we can do. But while the federal level continues working out their budget priorities, we as a county need to also have conversation and start planning together as well. Thank you, Commissioner.
Thank you very much. If you would like, you could reach out to Mr. Freeman to give him some information, and we'll be in contact to actually discuss some things further with you and your team. Thank you.
Good afternoon. My name is Linda Poley. I live in the city of Flint, South Side. Been a lawyer for 43 years now, most of it estate planning. I'm retired now. One of the things that is a major challenge for families is when an older family parent can't stay at home anymore for a variety of reasons. And many, regrettably, wind up in a nursing home. Between 80 and 90% of nursing home facilities in the United States accept Medicaid. Somewhere between 60 and 64% of the patients in nursing homes are paid for by Medicaid. I bet you anything in Genesee County, that's a higher number. Now, what happens when somebody's in the hospital and they need to be discharged to a nursing home is the discharge planners send out notices saying we have a patient that needs placement. They're on Medicaid, they're not on Medicaid, they need these special services for example, for breathing and that sort of thing. And they wait for what they call the bed offers to return. And sometimes the family has a choice. You never have a complete choice. There's 18 nursing homes in Genesee County, and there's never 18 with vacancies. But if you are fortunate, you might have a choice for now. If they cut Medicaid reimbursements, which I think is the best case, we're going to start seeing beds moving away from Medicaid beds to non-Medicaid beds. They will diminish. I wouldn't be surprised if some facilities just closed altogether because the economics become unmanageable. What I would like you to do is, if you do decide to take an active role in this, and I hope you do, talk to some of your family members or talk to your constituents who have family members in nursing homes, because it will make a huge difference in all of their lives. Thanks for the extra time. I appreciate it.
Good evening. My name is Eileen Hayes. I am also a Flint resident, and I am the Executive Director of Michigan Faith in Action. I'm also a member of the coalition of organizations that has joined together to work to fight against these cuts against Medicaid and also the connectivity that has against SNAP. There is a direct connectivity between Medicaid and SNAP. Obviously, if you don't have money coming in for your health care, you can't eat as well. You've got to eat. So 55% of Genesee County residents also receive SNAP benefits. 1.6 Genesee County residents receive TANF benefits. These potential cuts come at a time when there's an increased demand for food assistance at high prices. So it is critical that we continue to make sure that these cuts that are coming down from the federal government do not happen. So we highly encourage you to support us, as we certainly hope that you do work with us to make sure that this doesn't happen. I see that I'm in good time here, so I thank you for your support. Most of our points have been made this evening. Thank you.
Thank you.
Hello, my name is Dr. Asia Harris. I am a Ward 7 Flint resident and family doctor here in Flint at my clinic, Harris Family Health. I'm here to speak in opposition to reducing the federal medical assistance funding and encourage robust preparation if funding is reduced. Medicaid is a lifeline for almost 3 million people in Michigan, and Medicaid is essential to improve health outcomes and quality of life. I care for patients who are on Medicaid, patients who depend on medical coverage, transportation needs, mental health services, and more to help manage and address their medical concerns. I know that 80% of someone's health is outside of the health system, and Medicaid helps people with the SNAP and other programs. Congressional action limiting healthcare-related taxes is a direct infringement on states' rights to design their own tax policy to best suit their residents. And changes to federal funding will shift costs from the federal government to the state, creating a bad financial situation for Michigan that will lead to a healthcare crisis. Michigan, including Genesee County, does not have the resources to shoulder the burden of a public health crisis or economic recessions. Michigan and Genesee County residents will suffer. I'm asking you to use your influence and power to support opposition to any major changes to Medicaid policies or funding. but also to start brainstorming, creating a plan of action in response to the potential changes. Any change will end the necessary access to care for millions of people, and Medicaid funding impacts more than our most vulnerable population. They will cause important services to be cut, including hospital closures. These changes will impact all residents, including those with commercial insurance, by reducing access and jeopardizing lives. Cutting funding is cutting care, but we need a plan here in Genesee County. Thank you.
Good evening, everyone. My name is Gregory Boggs. I'm a lifelong resident of Genesee County and lifelong resident of Grand Blanc Township. I'd like to just formally introduce myself. I've applied for the expired term on the Genesee County Road Commission Board of Road Commissioners. Been in public works for 25 years. Started at the bottom from maintenance to inspection to the title I hold now as assistant director. Also served as interim director. Some of my extracurriculars, I serve on a nonprofit foundation that my family runs. I serve on my homeowners association board as one of the board of directors. I've served on Grand Blanc Township's Historic District Commission as vice chairperson and treasurer. So I'm very well-rounded on legislation and operations, and I would definitely hope you would consider me as an appointment. I can definitely do good things for Genesee County. Thank you for your time and your consideration. Thank you.
Good evening. My name is Mike Yancho Sr. I'm the newly elected treasurer for Grand Blanc Township, where I reside. I've been going to Grand Blanc Township meetings and taking part in the activities and watching Grand Blanc grow and maintain its Department of Public Works. And so I'm acquainted with Mr. Boggs. And I've watched him manage his department. He does a wonderful job. He has deep knowledge of all of the systems, the water, the sewer, the roads, etc. And he also understands the finances and the budget implications of things that go on in regard to his duties. So I would greatly ask for your support for Greg Boggs for the position on the Road Commission. Thank you.
Good evening.
Evening.
Scott Bennett, Grand Blanc Township Supervisor, resident of Grand Blanc Township. Although I lived half my life in the city of Flint here, I just want to say I think we have a fabulous county board of commissioners, and it's been a pleasure to work. I pretty much I know each of you, and from whether it's been working on a current board or as previous friendships, what have you, but I think you guys are going to do some great things for our county. I want to say just a word briefly. I know Ian, and he'd be a great person on your airport board. I came this evening specifically for Greg, and I think his credentials speak for himself and his length of time at our township. And with the amount of work that we have going on at any one time, I mean the public work projects we have going on are in the tons of millions every year. So I'm going to speak to Greg as an individual. I've got to say that my wife and I would trust anything to Greg and his family, whether it be our children, our finances, anything. The integrity that Greg brings to anything that he does is phenomenal. And if there's somebody that that stays late at the office and comes in early, it's Greg. Greg is the person that if I were out of town and I needed somebody to do something, whether it's personal or business, and I can call Greg, and I would trust him to do the job phenomenally. He's somebody that you can trust to get a job done, and he'll do it with ethics and with care, and he cares about individuals too. And he's a people person, but he also is very professional in the work that he does with our DPW. And I'd highly encourage you to consider him for the position. I think that he would be a great asset to the county and to the road commission. So thank you very much. And thanks again for your work.
Is there anyone else that would like to address the board? Is there anyone else who would like to address the board? Is there anyone else who would like to address the board? Public comment is closed. There's no-
Mr. Chair, can I ask a question of you? Given that there were several comments about appointments, I know that they're not on our agenda this evening, but can we let the audience know when to expect that?
As we spoke of, trying to get it for that 60-day window, so we have a month for applications, which I'm sure you guys have all seen. The application process has increased, just by doing this, has increased the amount of applicants we have had. Right now, Mr. Freeman and I had a conversation, I don't know, last week. They're taking all those applications. Mr. Winfrey and I have worked hard to highlight a process that we want to see if they're qualified or unqualified, which basically that means, one, some of the parameters we put in place as far as, one, live in the county would be, something important. Some of the other parameters that we'd put in place, not being behind on if they'd ran for a previous office, on their campaign finance funds, not being behind on those. So he's going through that process. Then, once they're through that, we will meet. From there, we'll go over it. And then by the end of the month, the last board meeting, we plan on having it on the agenda to vote.
Thank you.
Anything else from any other board member? Okay. Once again, no communication, no reports from standing committees. Board of Commissioners has nothing under Section A. Community and Economic Development, Dr. Beverly Brown, Chairperson, Dale Wayhill, Vice Chairperson.
Thank you, Mr. Chair. I move Resolution 2025-1203, approval of an agreement between Genesee County and ERG Environmental Services to provide for Genesee County's Household Hazardous Waste Collection Program. The cost for this agreement will be paid from account number 872, ending in 006.
Support.
I have a motion and support. Any discussion? With no discussion, all in favor?
Aye.
Opposed? Motion passes.
Mr. Chair, item number 2, 2025-1297, Commissioner Lloyd, whose district this is in, has asked that this be postponed. I know that we're working on a special CNED committee meeting for 2 weeks.
Yes.
No, actually, it's next week, isn't it?
Next
Yeah.
week.
Next week, and postponed till next week's CNED committee.
Thank you.
Do you need a motion on that, or are we good just to do it without objection?
If you would like to put a motion forward.
I'll move that we postpone it to next Wednesday evening.
And I support.
We have a motion and support. Any discussion? All those in favor?
Aye.
Opposed? Motion passes. Do you have any report?
No report, Mr. Chair.
Thank you. Finance Committee, Chairperson Martin Kuzno, Vice Chairperson Gary Getzinger.
Mr. Chair, I move Resolution 25-1159, approval of a purchase order to Dell Incorporated for fiscal year ending 2025 in amount not to exceed $111,422.50 to provide for the purchase the purchase of computing equipment. The cost of this agreement is paid from the following account.
Support. I have a motion and support. Any discussion? No discussion. All in favor, say aye.
Aye.
Opposed? Motion passes.
I move Resolution 25-1207, forwarding to receive and file a copy of the paid county bills for the weeks ending 2/9/25 to 16/25 in the total amount of $22,118,308.87.
I have a motion and support. Any discussion? No discussion. All in favor, say aye.
Aye.
All opposed? Motion passes.
Move Resolution 25-1215, approval of a proposed amendment to the 24-25 appropriations resolution for various line items as described in the attached budget adjustment request.
Support.
We have a motion and support. Any discussion? All in favor, say aye.
Aye.
Opposed? Motion passes. Do you have any report?
Thank you, Mr. Chair. No, not at this time.
Thank you. On to government operation. Chairperson Dale Wayhill and Vice Chairperson Sean Shoemaker.
Thank you, Mr. Chair. I move Resolution 2025-1160, approval of an MOU between Genesee County and the University of Michigan Flint for Genesee County employee tuition discount.
Support. I have a motion and support. Under discussion, do we have any discussion? There's none of the board members. Do I have a bit of discussion? This is just for master's level programs? Am I understanding that
I
correctly?
think it's both.
Jerome is here, he can speak to that.
I don't know why you guys sit all the way in the back. It's a longer walk up here.
Good evening, Commissioners. That is for undergraduate and graduate.
Oh, thank you so much. If no one else has anything, all in favor?
Aye.
Opposed? Motion passes.
All right, Mr. Chair, I move Resolution 2025-1223, approval of a request from the Diversity, Equity, and Inclusion Commission to declare March 2025 as Women's History Month in Genesee County.
Support. I have a motion and support. Any discussion?
Mr. Chair, if you'll indulge me, I'll read the motion into the record for the full commission meeting, and so that members of the audience know what we're voting on. Women's History Month resolution. Whereas Congress overwhelmingly passed a resolution in 1987 declaring March to be Women's History Month, which proclaimed that American women of every race, class, and ethnic background have made historical contributions to the growth and strength of the nation in countless recorded and unrecorded ways, that American women have played and continue to play a critical economic, cultural, and social role in every sphere of our nation's life by constituting a significant portion of the labor force working in and outside of the home. American women have played a unique role throughout their history, our history, by providing the majority of the nation's volunteer labor force, and have been particularly important in the establishment of early charitable, philanthropic, and cultural institutions in this country, and that American women of every race, class, and ethnic background served as early leaders in the forefront of every major progressive social change movement, not only to secure their own right of suffrage and equal opportunity, but also in the abolitionist movement, the emancipation movement, the industrial labor movement, the civil rights movement, and other movements to create a more fair and just society for all. And whereas women in Genesee County have similarly been integral to every facet of community life, from the Women's Auxiliary and the Women's Emergency Brigade's role in supporting the establishment of the United Auto Workers during the sit-down strike, to the role of Olive Beasley in organizing the 10-day sleep-in on the grounds of Flint City Hall in support of fair housing, to holding positions of leadership in local educational, healthcare, industrial, civic, and financial institutions. And whereas to date, a total of 23 women have served on the Genesee County Board of Commissioners, starting with Charlotte Williams in 1965, who also served as president of the National Association of Counties, and including 2 women who served as chair of the Board of County Commissioners, Deborah Cherry and Ellen Ellenberg. And whereas 2 notable women are honored on the grounds of the Genesee County Courthouse, including Sarah Emma Edmonds, who was born in Canada and moved to Genesee County, where she joined the Union Army in 1861, disguising her gender as she fought valiantly with Company F, 2nd Michigan Infantry, at the Battle of Bull Run, and with the Army of the Potomac at the Battle of Fredericksburg. And whereas Genesee County has also memorialized the contributions of Eva R. Bells, a Flint resident who in 1888 attempted to vote in a school board election, but was turned away from the polls on the basis of being a woman, and who successfully sued in Genesee County Circuit Court and prevailed at the Michigan Supreme Court to secure women's right to vote in local school elections. Now therefore be it resolved that the Genesee County Board of Commissioners and the Genesee County Diversity, Equity, and Inclusion Commission hereby recognize the month of March 2025 as Women's History Month in Genesee County, and encourage the celebration of Women's History Month, participation in community events, sharing stories, and learning about the struggles women have faced and the contributions they have made to our county and our nation. That is the end of the resolution. My only comment is that the daughter of Charlotte Williams, who was the first female chair of the Genesee County Board, is in the audience with us today. Ms. Kathy Saunders, if you would stand and wave at us. Charlotte, when I was on the Flint City Council, I met Charlotte knocking on doors and kept up contact with her until her passing. So this honor is for her and all the other women in our county. Thank you.
Is there any other comment from the board?
I just want to thank Commissioner Wayhill for presenting this resolution, And I had an opportunity to participate in a International Women's History Day event last Saturday that went on at Wilson Park here in downtown Flint. And it was just, it's always encouraging, and it strengthens me, and I'm sure other women in Genesee County, to know that, you know, my colleagues around this table support Women's History Month. So thank you.
Thank you. Is there anyone else that would like to say anything, speak? With that being said, I'm going to say something real quick here. What an amazingly well-done resolution. I wonder why we haven't done it before. I'm going to say this. I took a lot of flack for my stance on the DEI committee and the way I thought it was being directed. And I wouldn't say it's just flack. I took personal attacks on myself and my family and my job. I'm hoping that maybe through this, if we are going to really look to carry out what this board's plan was for DEI, we will continue to see all people who have contributed, because we are one society. We are one great nation because guess what? Everyone has played a part in this. Whether it's good, bad, it's our history. It's who we are. It's what's made us. It's what's made us strong. So I'm happy to see the language change in the DEI portion of it. I hope we are committed to it like the last resolution stated, if that's what we're going to do, if that's what this board says. Now, I'm hoping, though, as we move forward, that we are going to include all. That means all. I'll be interested to see where that goes. I do have one question, though, and I don't know if anyone can answer this since it's your committee. The Board of Commissioners and the DEI committee honored Women's History Month, but no other department wanted to participate in that or anything else like that.
Can you repeat that?
Well, it normally would be the Board of Commissioners would honor Women's History Month, and there's a statement in there that says, wherefore, the Genesee County Board of Commissioners and the DEI Committee honor Women's History Month. I just wondered, we are the Board of Commissioners, they operate under us, but if we're going to list different departments or different committees, is there other committees that want to participate in that also?
So they wrote this one. I wrote the one on Black History Month, which didn't start out with the same preamble. You'll recall that we had some discussion where we might look to them to help us write some of these, if not all of them going forward for our consideration, not that we would have to accept them. So this one happens to be worded in that way because we had that discussion. I think it's a fair point that you make. For me, it's more about us as the leaders of the county. There's no executive in the county. We're the highest elected officials, recognizing and celebrating this month, which, as you heard, has been in place nationally since the 1980s, similarly to Black History Month, even prior to that. So that's the explanation of why they're mentioned in there. Going forward, we could still perhaps have them assist us with the writing of it, but maybe they're not in the preamble of it.
Well, and if that's, just as a point, thank you for that. I appreciate it. As always, Commissioner Wayhill, I appreciate your insight and openness to think outside of what's the norm. My thought is, though, once again, I speak to inclusivity, and it's a big word. We might have other departments who want to participate in that, but we are one board. There's no other board outside of us, parks or anything else like that stands above the county board. So seeing that additional language in there, I'm going to vote yes on this today, but moving forward, I think we really need to look at that moving forward. Whether we're going to put other committees in there, because there are plenty of other committees that probably would want to participate in this, parks as an example.
And to that point, Mr. Chair, I don't have it in front of me, but I believe the way I worded the end of the resolution for Black History Month is that we as a commission were recommending that the departments and offices under the county celebrate it equally, and that we were going to send a copy asking the clerk to send a copy to all of our municipalities. So they didn't use that as a model, but maybe we could kind of get back to that to a certain degree to reflect what you're saying going forward. So I'm not opposed to that.
Thank you. And don't take me wrong, I think that, like I said, I think it was worded very well and written very well, with a lot of care. So is there any other discussion? If there's no other discussion, all in favor?
Aye.
Opposed? Motion passes.
All right, Mr. Chair, I move Resolution 2025-1251, approval of an agreement between Genesee County and New Paths Incorporated in the amount of $250,000 to provide medicated assisted treatment, MAT, medicated opioid use disorder, MOUD, inside the Genesee County Jail. The cost of this agreement will be paid from the account listed.
We have a motion and support. Any discussion?
Mr. Chair, if I might, I know Captain Kennemer's here. If he'd come forward, maybe tell us overall what this is going to do. I know we had discussion at the end of last calendar year, and the commission was fully supportive, but I could use a refresher on exactly how this is going to work, if you would.
So first of all, for myself and the sheriff, we are thankful for the support from the commission on this program. It's vital to both our community and to running a safe, secure facility. Basically what this is it provides medical assistant treatment when someone's going through a opioid addiction and detox to help them safely continue, if they're on that program out in the world and they relapse and they come into jail, to continue that program while they're incarcerated. And then if they are starting those DTs, to start them on a program as well. Since you approved the grant at the end of last year, we've been busy beginning the implementation of this. We have a full-time coordinator that coordinates between all of our community partners, working with New Path, working with our medical department, working with our RISE team, that when they get out of jail, to make sure there's a continuation of that treatment when they get out. We've implemented an interview process where someone comes into jail initially. They get interviewed on intake. They then get interviewed by medical personnel within 24 hours of them being there, and then a third time at classification. In addition to that, that coordinator goes and does daily interviews up on the pod because sometimes they're not up front in the initial phases, so we try to catch them on the backside phases as well. That's kind of where we're at in a nutshell. This $250,000 is vital with the partnership with New Path to help provide that medication because it is expensive, and we'll go through that process going forward. Currently, to date, we've served about 78 individuals in our facility from January to now that have been on a MAP program.
Thank you, Captain. And if I may continue through you, Mr. Chair. So the folks that can participate or benefit from this are those individuals who are in the community, commit some infraction, they're already on one of these MAT programs in civilian life, then they're in the jail and they can continue under this. Is that correct?
Correct. The goal this program has two parts to it. One, it has a continuation of care on that. So if you're already participating in a MAT program, when you come into jail, we want to have the continuity of care. Two, if you need to start participating in it, that's the avenue that we're starting to dial in now. Okay. You don't have to start it out in the world, but when you're in jail, sometimes that's the best place to start recovery of your life. And
Okay.
It was great for us.
All right. I'll just remind my colleagues there, I think is it Captain Macy?
Yes.
Is it Captain? Is she a captain?
She is a captain.
Okay. And others from the opioid task force spoke about this at the end of last year and gave us some examples of horror stories where there are inmates in our jail who don't have access to this, who are living in total misery as a result of having to detox when they're incarcerated. So as we think about the opioid settlement dollars and the task force that's working on that, I'll be very interested in watching how this works and maybe putting some more resources behind it from the settlement dollars. So thank you.
Thank you.
Thank you, Mr. Chair.
Is there anyone else that would like to speak? If not, when this came to us before, we'd mentioned a barometer for measuring whether we have success with these. And I've talked about this again and again, that these programs are all wonderful, but if there's no way to measure whether we're successful or not? How do we know we're not just going out in the middle of the street and handing out dollar bills? That might be just as effective. So is there any way that they can track this or we can track this, the success of, I mean, obviously, you know, how, if they went out or they came in, they're addicted and they're back in 6 months later, you guys can track that, but is there any way to track them once they're out, if they're not getting arrested again? Is there some way we can tell that these dollars, and obviously so the residents know these are not general tax dollars, they're opioid tax dollars that we've received in the settlement. But is there a way to track that?
Absolutely. So there's several ways that we track it. Once they're referred to our RISE team partners, they have the continuation of services once they get out of jail. So counseling services, treatment programs. Obviously, the jail will know if they come back to jail and then continue that service forward. Also, all the opioid overdoses and deaths are tracked through the county all the time, and we get monthly stats on that. And that is a viable way to see if this is making a dent in the opioid crisis and making citizens of our county safer.
Would there be a way for you to come back to this board maybe quarterly to show us the success we're having, or, I mean, which I'm praying it's success, because when you watch somebody go through detox, it's a very ugly process for everyone involved. So is there a way, and would you guys feel comfortable coming back in 3 months and giving us a report on where we are?
At the board's pleasure, we'd be happy to share any of our successes, our challenges, and our outcome.
If you would do that, I would greatly appreciate it. Would the board be happy with it? Would that be something that's okay? Dr. Brown, please.
Thank you. So my understanding is that with the opioid settlement funding that is available, that 70% of it has to be used toward prevention and treatment, and the other 30%, I think, is discretionary. Is that correct?
I am not the expert on the opioid settlement funds.
Okay.
I'd be happy to take 70% of that money, though.
Okay. I wonder if you could speak to the level of collaboration, because I know there's an executive committee that has been put together to handle the opioid funding that comes into our county. Can you talk a little bit just to let the public know about the level of collaboration that's going on right now?
I can speak to the collaboration level from the sheriff's office. There is an opioid executive committee that's managed by our community corrections. I don't see her here today. But the sheriff's office works hand in hand with community corrections. They've been a vital part of this program. And with that also comes a partnership with New Path, with the Greater Front Health Coalition, with GHS. They're all partnering and trying to combat this crisis on the ground level, if that answers your question.
Thank you, yes.
Is there anyone else from the board that would like to make a comment? I have one other one. What are we doing as far as prevention? Is there anything out there? Because we'd spoken on this as a board a couple years ago, and I was, concerned with the fact that, yes, we're dealing with the treatment, but we're not dealing with the prevention side of it. Is there anything we're doing, or you guys are doing as the sheriff's department, or we can assist with these dollars to stop in the prevention of it before it even gets to that point?
Absolutely. We came to the board, I believe it was last year or the year before, to start our interdiction team. Our interdiction team is an avenue of our GHOST, Genesee Human Oppression Strike Team. Most people know it as a human trafficking task force, but it also has the combat of the opioid, because they go hand in hand. So we have dedicated officers, dedicated investigators that conduct targeted opioid enforcement. They focus on taking a case from an overdose to a conviction of the dealer, not the person that overdosed. We want to stop the supply, we want to stop the dealer, and we want to get hope to those that overdose. So the sheriff's office, it's a two-combated level. There's the ghost interdiction, where we're fighting the dealers and the opioids coming into our county, and then there's the MAT program, where we're treating the people that are addicted and are needing assistance and treatment.
I was going to raise my hand, actually, isn't that? Forgive me, it's my first time. Commissioner Wayhill.
Just something that might be helpful to your question and to what Dr. Brown asked. So I've been asked to sit in on the, I guess, is it called a task force? The opioid settlement task force? So I've sat in on 2 of their meetings thus far, listening, asking questions, and they do have a diverse membership, a diverse group of partnerships. I think that there are certain agencies in this sphere that aren't at the table because ultimately they may compete for dollars, and I think they're very sensitive to conflicts of interest. But there is a diverse group. And then to your question, Sean, on the prevention side, the group is starting to put together a list of recommendations for settlement money to be spent on prevention and some of the other categories. And are they coming to us, Josh? Yeah, but we don't have anything scheduled right now.
No, I think they're waiting on the MSU piece.
Yeah, there's an
which is another-
MSU is providing technical assistance to do a survey of local folks who are, I don't know if these are people that are actually suffering from opioid addiction and providers,
Yes.
everything.
Yep.
So they're gathering that last piece of qualitative data to put with quantitative data. Then they're going to formulate recommendations based on that and come before us before they can spend any additional dollars. And a big piece of that, as I understand it, as I hear it, will be prevention.
Anyone else? I just have one thing. Are we working with the state police on this, federal government on this? How does it work? 'Cause obviously, they're not producing, these labs aren't here in Genesee
which
County, are
part-
they?
to
As
which
far as the
question,
prevention, as far as the prevention portion of it.
The prevention, we work with all of our partners. If we get a referral from another agency that crosses jurisdictional bounds, we work with all of them. We have great relationships with all the police agencies in the area. They aren't anyone assigned to our unit, it's an internal unit, but we will work cases together, especially if it crosses jurisdictional bounds.
One other question, and I'll leave you be. The source of these, is it from Genesee County, or is it someplace else
You're
where?
talking the source?
The source of the drugs, I'm sorry.
It's coming from Mexico, is where the primary opioid or fentanyl pathway is.
Thank you. I look forward to seeing your report in the future. Thank you. Okay. If there's no more discussion, all in favor? Aye. Opposed? Motion passes. Is there any report from your?
No report, Mr. Chair.
Okay, next up, Human Services Committee, Charles Winfrey, chairperson, James Avery, vice chair.
Thank you, Mr. Chairman. I move resolution 2025-1211, approval to accept the Glow and Grow Grant Award in the amount of $25,000 from Region 6 Perinatal Quality Collaborative to enhance birth outcomes, reduce health disparities, and address underlying causes of inequities within our community. No additional county appropriation is required.
Support.
I have a motion and support. Any discussion? All those in favor?
Aye.
Opposed? Motion passes. Is there any report from the
No
committee?
report, thank you.
Next up, Public Works Committee, Brian Flewelling, chairperson, James Avery, vice chairperson. Mr. Avery.
I'll take that. Thank you, Chair. I'd like to move Resolution 2025-1224, approval of a purchase order for Seattle Services for the fiscal year ending 2025 in an amount of $153,166.36 to provide for the payment of janitorial services for the end of the contract. The cost of this purchase order will be paid from the accounts listed.
Support. I have a motion and support. Any discussion? No discussion. All in favor, say aye.
Aye.
Opposed? Motion passes.
No report.
No report. Okay. With that, we have no unfinished business, new and miscellaneous business. I will turn it over to our corporation counsel.
Thank you, Mr. Vice Chair, Mr. Chair.
Thank you.
As you know, the Open Meetings Act allows this board to go into closed session for certain reasons, and one of those reasons under MCL 15.268 subsection 1 subsection C is for strategy and negotiation sessions connected with the negotiation of a collective bargaining agreement. If either negotiating party requests a closed hearing, it's my understanding that this board wants to go into a closed session to discuss contract strategy and negotiations with the POAM union believe that's the Police Officers Association of Michigan. And so I'd ask somebody to make a motion. You need 5 votes via roll call.
I'll make a motion to go into closed session. Roll call, please. We have a motion and support.
Commissioner Winfrey?
Yes.
Commissioner Getzinger?
Yes.
Commissioner Brown?
Yes.
Commissioner Avery?
Yes.
Commissioner Shoemaker?
Yes.
Commissioner Kuzma?
Yes.
Commissioner Wayhill?
Yes. Motion passes. We're now in closed session.
One of us going the wrong way. I know. Not sure who, but.
We're now coming out of closed session to open session. Now we're going to adjourn the meeting at 7:22, if there's no objections. Need a motion to adjourn.
So moved.
All in favor?
Aye.
Opposed? Motion passes. We're adjourned, 7:22.